You've tried everything: the viral TikTok routine, the expensive serum, the supplement your favorite influencer swears by, and your acne is still there. Here's the problem: most acne advice online is not based on evidence, it's based on what sells. In 2024, the American Academy of Dermatology published its most comprehensive acne guidelines to date, a systematic review of hundreds of clinical trials. This video is based on that document: what actually works, what doesn't, and what the science says about the things you've probably already tried. First, what acne actually is. Acne is a chronic inflammatory disease of the pilosebaceous unit, the structure that contains your hair follicle and sebaceous gland. It involves four main factors: excess sebum production, follicular hyperkeratinization, colonization with a bacteria called Cutibacterium acnes, and inflammation. This matters because the treatments that work target one or more of these factors. The ones that don't work usually don't target any of them. One more thing before we get to treatments. Routine bacterial cultures are not recommended in standard acne management. The results don't change how acne is treated. Hormone testing isn't needed for most people either, but if your acne comes with other signs, hirsutism, irregular periods, androgenic hair loss, or infertility, an underlying hormonal condition should be ruled out. What the guidelines strongly recommend. Strong recommendations mean the evidence clearly shows benefits outweigh risks. There are four of them. Topical retinoids, the cornerstone of acne treatment. They are comedolytic, anti-inflammatory, and help prevent scarring. Four types are FDA approved: tretinoin, adapalene, tazarotene, and trifarotene. Side effects: dryness, peeling, irritation are common but manageable. Starting at a low concentration, using a moisturizer, and adjusting application frequency significantly reduces these effects. They can also cause sun sensitivity, which is why daily sunscreen is essential. Benzoyl peroxide, an antimicrobial agent that releases free oxygen radicals. Importantly, no bacterial resistance to benzoyl peroxide has ever been reported, making it one of the most valuable tools in acne treatment. Combined with topical antibiotics, it both enhances efficacy and prevents resistance development, a combination the guidelines specifically emphasize. Side effects are concentration dependent: dryness, irritation, and bleaching of fabrics and bedding. Topical antibiotics: clindamycin, erythromycin, minocycline, dapsone. These work through both antibacterial and anti-inflammatory effects. One critical point: topical antibiotic monotherapy is not recommended. Used alone, they promote antibiotic resistance. They should always be combined with benzoyl peroxide. Oral doxycycline, the first-line systemic antibiotic for moderate to severe acne. Well-studied, effective, and recommended based on current evidence. Side effects include gastrointestinal disturbances and photosensitivity. Systemic antibiotics should be used for the shortest duration possible, typically no more than 3 to 4 months, and always alongside topical therapy. What about isotretinoin? Oral isotretinoin is strongly recommended for severe acne that is causing scarring, significant psychosocial burden, or failing to respond to standard treatment. Two concerns come up constantly: inflammatory bowel disease and psychiatric effects. Population-based studies have not identified a significant association between isotretinoin and either of these conditions. In fact, multiple studies show that isotretinoin actually improves quality of life and reduces anxiety and depression in patients with moderate to severe acne. That said, monitoring is appropriate. Liver function tests and fasting lipids should be checked. For patients with pregnancy potential, pregnancy prevention is mandatory throughout treatment. The conditional recommendations. These are treatments where benefits and risks are more closely balanced. Salicylic acid, conditionally recommended, available over the counter, useful for comedonal acne. Azelaic acid, conditionally recommended, particularly useful for patients with darker skin tones due to its lightening effect on post-inflammatory hyperpigmentation. Clascoterone, a topical anti-androgen with high certainty evidence, but conditionally recommended due to its high cost. Topics with insufficient evidence for recommendation: tea tree oil, topical green tea, topical witch hazel oral zinc, oral or topical niacinamide, oral pantothenic acid, laser and light-based therapies, photodynamic therapy, chemical peels, insufficient evidence to make a recommendation for most devices and protocols. And diet? There is conflicting evidence on low glycemic diet. Some trials show modest benefit, others show no significant effect when added to topical treatment. For dairy products, omega-3 fatty acids, and chocolate, evidence is insufficient to make any recommendation. The honest answer is, we don't know enough yet. The association between diet and acne is biologically plausible, but the clinical trial evidence is not strong enough to give specific dietary recommendations. The most important practical point: combining therapies that work through different mechanisms is recommended as good clinical practice. A retinoid, benzoyl peroxide, and a topical antibiotic together, targeting different parts of the acne pathway simultaneously, consistently outperforms any single agent alone. And whatever you're using, consistency matters more than the product. Acne is not a cosmetic problem. It's a chronic inflammatory disease affecting over 50 million people in the US alone. The science is clearer than the internet makes it seem. The treatments that work have been studied for decades. Start with what works, be consistent, and give it time. This is Shadow Atlas.